according to this European Orthopedic Journal article, the number one most common musculoskeletal injury in the winter are knee ligament injuries. Most specifically, we're talking the ACL, anterior cruciate ligament, and the MCL, the medial collateral ligament. Now, these injuries are typically going to happen when that knee gets torqued too quickly internally, and then it takes the ligaments past their normal anatomical load and causes either a partial tear, a sprain of that ligament, or, God forbid, a full on rupture of the ligament. The most common way that this is going to happen in the winter months is with the downhill skiers and those that do snowboarding. So, our recommendation is to know your physical limits. If you're headed out to like Tussey Mountain and you know that the certain hill is maybe a little more challenging than what your skill set is, then don't let anybody peer pressure you or buddy pressure you into going beyond your physical limits. Know what your conditioning is, have good high quality equipment, and if you're not certain, pay for some lessons, like have somebody coach you up, because it's definitely not going to be fun to have to rehab through a knee injury. Now, if we're talking about a full blown tear or like even a partial tear, that's going to be talking to orthopedics, and they're going to make that assessment of if you need surgery or if they think you need some physical therapy. Really, the mild sprains or like the moderate sprains even of these two major ligaments, sometimes you won't even know that those are the ligaments that are injured. You'll just feel that you have knee pain. And if that's the case, sometimes those are the ones that we get in office and we don't necessarily obsess about what is the specific diagnosis. We just treat the knee functionally, throw some McKenzie Method rehab therapy at it to give you something to work on at home, work through adjustments, lots of muscle work, some strength and stability over time until that issue is cleaned up. The other thing to be vigilant with the knee ligament injuries too is as you fall on ice, being careful with these falls and being really careful on ice and being very cautious about not letting that knee get torqued on you.